afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have, disponible pour répondre aux questions des médias, nous accueillons in Council Chambers, Mayor Le Maire Jim Watson, Steve Kanellakos, City Manager, Directeur municipal, la Docteur Vera Etches, Medical Officer of Health, Médecin-chef en santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. Phoning in today, we also have Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, Président du Conseil de santé d'Ottawa, Dan Chenier, General Manager, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations, Kevin Wiley, General Manager, Public Works and Environmental Services, Directeur général des travaux publics et de l'environnement, and members from his team, Scott Laberge, Director, Technical Innovation and Engineer Support Services, Directeur, Service de soutien d'ingénierie, d'innovation et de technologie, and Nicole Hoover-Bienas, Program Manager, Long-Term Planning, gestionnaire de programme, planification à long terme. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque...
By alphabetical order, I ask every organization to ask one question and one follow-up question.
Lose you during the call, please try phoning in again or contact Media Relations to submit your question. We will now start with Amanda Pfeffer at CBC Ontario.
Hi, I'm asking about the safety of individuals who have received just a single dose, and when we might see some change in the advice to them. Right now, it's sort of an abstinence advice that you should behave as if you've had no shot at all. But when can we begin to see some guidance on whether it's safe to be with other single dosers doing activities like eating together, that kind of thing? Is there some guidance in the works and what we need to see, whether it's case counts or what that could look like, what the guidance could look like? What can we expect in the future as more vaccinations take place, cases go down?
Thank you for the question. It's Vera Etches. I know that this is something the province is looking to provide advice province-wide about changes as the immunization coverage rate goes up. So the idea is that right now we still need all of the measures in public spaces because we don't have a population level of immunity that's sufficient yet with still the work underway to immunize all people over 12. So I think you're right. There will be progressive relaxation of measures as time goes by, but we know one dose is not full protection. It's not the maximal protection that we can get from the COVID vaccines. We do need 2 doses to see that, and we're learning about the variants of concern and how really that second dose is an extra level of protection that could make a difference around our comfort level with people's ability to be infected with variants of concern. So this is something we know people need more guidance. What we have right now in Ontario is the provincial plan for reopening, and that's focused on progressively, cautiously increasing the number of people we can have contact with outdoors, and then moving into indoor settings where masks can be used, and then opening things where there aren't any masks. The idea of different advice based on your level of vaccination, I think, will be added in when we have more evidence that the vaccination rates are high enough and we can be confident about, the recommendations.
Just as a follow-up then, we know that there was this... Can you hear me?
Yes, we can hear you better now.
We know, we heard last week the Public Health England came out with that report showing that the single dose is only 33% effective from disease for the Indian variant that came from England, and 50% for the B117, which is now dominant in Ontario. To what they're urging the second dose be sped up in England. To what extent do we need to think about that here in Canada?
We would like to immunize people fully with those 2 doses as soon as possible. And so I know that as the supply of vaccines increase, that is what the provinces are looking at, being able to shorten the interval so people may not have to wait 16 weeks for that second dose. It does depend on the supply coming into Canada and then to Ontario, and those decisions are made at a provincial level.
Thank you.
Thank you very much. Who do we have from CBC Ottawa?
Hi, it's Kate.
Go ahead, Kate.
Hi, everybody. My questions are for Mayor Watson on the MRAC application. First off, Mayor, there's been a lot of outcry in the last week and a half or so, and do you not have any reservations about this application and the tax break, given it's on a main street and it'll run contrary to the new official plan?
So I didn't hear the first part, Kate. You said there's a lot of
outcry.
Oh, sorry.
I just wondered if you have reservations at all about it.
No, I don't, because the rules of the program are set out very clearly. Every member of council who was at the meeting voted for the community improvement plan. It's to act as a magnet to get companies and businesses to move into economically challenged neighborhoods. And at the end of the day, as you saw, there will be an additional $6 million invested in affordable housing. So it's a win for the taxpayers because we're $6 million ahead. It's a win for the affordable housing community because we're going to invest all of that money in affordable housing. And it provides an additional 20 jobs, and it attracts a business that would otherwise not consider or locate at that particular site. So I think the majority of members of council saw this as an opportunity to finally give a little bit of an uplift to Overbrook Forbes and the Vanier community, particularly as we invest $30 to $40 million in upgrading the sewers, the water system, bike lanes, trees and sidewalks on Montreal Road, which has really been neglected for a long time. So I'm optimistic that this is going to kickstart other people that we're going to want to invest on Montreal Road. And we saw and heard from the Vanier BIA, both their chair, who's also the chair of Okobia, as well as their executive director, that they see this as giving them a real fighting chance of finally bringing some economic activity and jobs to the Vanier Overbrook area. And at the same time, the added bonus through the motion that Councillor King and I put forward is an additional $6 million into affordable housing over the course of the term of the CIP. Thank you.
And I guess my follow-up would be then, could you just speak a bit about what reaction you might have personally been receiving in the last week or so? And I mean, obviously, your support has continued, and just wondering, if you were ever given to be swayed or not.
Yeah, I guess, we received a lot of emails. I think a national advocacy group was sending a lot of I can't remember the name of it. They're not spam, but they're stock emails from a lot of people. But I can tell you, I thought about this because I was out probably, I think, in 5 wards over the course of the long weekend, riding my bike around. I came across probably 90 to 110 people that would stop me or saw me stopped and chat it. Not one person asked me about this particular file, so it's got a great deal of attention in the media. I understand why. And it's got lots of form letters that come in, which I appreciate people's opinion on it. But certainly when I've been out and about, and it's sort of limited because I can't travel too much, but on the bike paths in Old Ottawa East and the Glebe and Centertown, out to Andy Hayden Park, Britannia, Lakeside Gardens, all of that area. And as I said, I get a fair number of people that come up to me on a regular basis, but people were coming up asking me all sorts of things, but no one actually brought that up. So I'm not dismissing the fact that some people are opposed to it, but I think it was the right decision. I think councillors, excuse me, King and Fleury took a lot of heat for it, but they know their wards better than anyone else, and they fully supported the initiative as you saw by their vote. Thank you.
Thank you very much. We will now be going to City News. Jason White.
Hi there. My question is for the Mayor regarding the Community Improvement Program as well. Mr. Mayor, I'm wondering how concerned are you that the vote taken today will open the door now to subsequent SIP applications having earmarks for councillors' pet projects, including some that you may not like or agree with?
Well, thank you, Jason. I don't agree with your characterization of affordable housing as a pet project. I think it's a council priority for all members of council, and I thought this was an innovative way of finding a source of revenue to pay for an increased investment in affordable housing. Excuse me. Any member of council can bring forward any resolution to spend money, and some I may agree with, some I may disagree with. We saw today that there were those members of council who, often champion affordable housing voting against this, which I found unfortunate. But we always need, as you know, in the budget process, you need a revenue stream to offset the expense. And this was a revenue stream that I thought would be well used for affordable housing. And the vast majority of members of council actually supported that motion put forward by myself and Councillor King. Thank you.
And as a follow-up, given the level of debate and fierce opposition from some people we saw to this application, what are your thoughts on the SIP program maybe needing more parameters and fine-tuning of the scope and what would and would not be approved? While this particular application may have met the test, what do you think about fine-tuning the requirements for future SIP applications?
Well, I think that, the city manager indicated that in the first year of the new term of council that they'll look at exactly what you've talked about. You don't want it to be too prescriptive because, you don't want to have a huge, long laundry list of things that are not eligible or things that are eligible. You want to try to make it attractive so that a company, if they're thinking of investing in Ottawa, will see this as a real good deal for them. And ultimately, as you know, I think what got lost in the debate and the emotion of the debate was that this program actually generates, I think it's 11 times more property tax for the city, so we can spend it on social service programs, public health, affordable housing, and the like. So the reality is that this is a good way of attracting an investment. This building is going to be about $17 million. It will be the most expensive investment building on Montreal Road in the last quarter century. I can't think of another building with, perhaps the exception of the beautiful Wabano Centre. So this is a private sector investment. They're going to be paying development charges, building permit fees, and ultimately going from about $35,000 a year that they pay now on this piece of land up to over $400,000. And that increase for the next 2 decades will actually invest $6 million into affordable housing, which I think everyone agrees is desperately needed in all parts of the city. Thank you.
Thank you.
Thank you very much. We will now be going to Josh Pringle at CTV Ottawa.
Thank you very much. My question is for Dr. Etches. 2 weeks ago, a city memo said 71% of staff at the Champlain long-term care home have tested positive had received their COVID-19 vaccine. Just wondering if the city considers that low, and are you concerned that there's still 30% of staff at this home, which is now an outbreak, that don't have the vaccine?
Thank you. I know that over the last 2 weeks there have been increasing efforts there's been ongoing, but especially also over the last 2 weeks, to get second doses to long-term care home and retirement home workers. And in that process of getting second doses, it's also been boosting the first dose coverage. So I think that there have been dedicated clinics organized, and also the promotion of vaccination on site in long-term care homes and retirement homes. So we are trying to get that level as high as we can. It's not realistic to expect that 100% of staff will be immunized. Some people have reasons not to be immunized, but the higher the better. And what we're finding is that the average across all long-term care homes has increased, so it's gone up even above 75%, and that's what we'll keep working on.
And my follow-up question, any idea how many of the staff and residents that have tested positive have been fully vaccinated at Champlain?
I don't have the specifics related to this particular outbreak. I know that is the kind of information that we collect for anyone who tests positive for COVID-19. We're asking about their immunization status. I am aware in outbreaks that often there is a situation where someone wasn't vaccinated. People who are vaccinated are less likely to get COVID. That's why we're encouraging everyone to be vaccinated. But once there is a COVID introduced into a setting, it can spread to people who are vaccinated, especially older adults, where that the study by Public Health Ontario shows that 1 dose provides very good protection. 2 doses, even better. It's really very rare for someone to test positive for COVID after 2 doses, but where it happens, it is more likely in people over 80. So we do need to continue all the measures that protect against introduction of COVID into long-term care homes. It's not just immunization, it's making sure people are able to stay home when they're sick and supported to do that. It's making sure people know how to wear masks and gowns and personal protective equipment, take it on and off safely, looking at the hand washing practices. All of these different layers of protection add up. And so we continue to work with our partners, the long-term care homes, the city, the regional infection prevention and control hub, to reinforce these practices, prevent outbreaks, and when the outbreaks occur, make sure that we can limit the spread.
Thank you very much. We will now be going to Craig Lord at Global Ottawa. Craig, are you on the line? Okay, Craig, if you're having audio issues, please contact Media Relations and let us know what your question is. Nous allons maintenant passer à Julien.
Now let's give the floor to Julien Paquette from Le Droit. Hello, everyone. My question is for Mayor Watson. This is concerning the project on Montreal Road. Essentially, the $6 million in net revenue for this new project, this will be allocated to a long-term, the housing long-term plan. So this $6 million will be received over a period of 20 years. So how can we make sure that this amount will be actually used for affordable housing? As you know, after each election, council members have the right to adopt the policies from the previous council. So for every single decision, not only that one, for any single municipal decision, there's always a possibility that the new council may suspend or cancel this decision today for affordable housing. I do not think that this will be the case. That every member from the right and from the left are supporting our affordable housing project. I hope that after the next elections, I would hope that every member will continue the affordable housing program. So I do not have the impression that the next council will cancel this decision. If you do remember, this plan is over a period of 10 years. So the next 8 years, decision will be either supported or rejected by another council. It's exactly the same thing for a major transportation project. Thank you so much. Follow-up question? This is regarding the sinkhole on the Rideau Street and the lawsuit. I assume that you can use some anonymous sources. So we know that the Supreme Court in Canada, actually, are you worried that at one point you will go against the Supreme Court, against the decision, and that you will end up in the Supreme Court? I would say that the issue was not a problem with the medias. Every media is receiving a brown envelope. I'm very happy to see that the commissioner will not be asking questions to journalists. His objective, and mine also, is trying to find the person who actually leaked a confidential memo to a member of the media. I do believe that Mr. Winning did a good work as a journalist. So if there's a member of our personnel or one of the member of the council provided this confidential memorandum, this is not good when we're going into court. So my objective and my responsibility is to protect the interests of the Ottawa citizen and the interests of the City of Ottawa. Thank you.
We will now be going to John Willing at the Ottawa Citizen.
Hi, Kina, thank you. Question for the mayor on the CIP matter. I'm wondering why you felt it necessary to add the affordable housing motion. You know, the votes were a lock, and I wonder why add that, what one councillor called that messy layer to the matter.
Sorry, what was that? The messy? I didn't hear that, John. The messy.
Yeah, Councillor Leeper called it he said it was messy, the way that you're going about trying to add the affordable housing motion to the CIP matter. So I'm wondering why you decided to do that when you obviously had the vote to carry the day.
Yeah, but I thought it was important. One of the things that I think we had to do a better job of communicating, that this was not a cost to the taxpayers. There was actually a positive benefit. And one of the ways of doing that very clearly is to indicate that we're going to be $6 million ahead as a result of the CIP, and we're going to take that money and invest it into affordable housing projects in the City of Ottawa. So I think it was it made sense, quite frankly, to let people know that A, this was not a drain on taxpayers, as some opponents have pictured it. We're actually ahead by $6 million, and 100% of that $6 million, thanks to the support of my colleagues on council, will actually go into affordable housing projects through the long-range financial plan for housing. So, you know, and I was pleased to work with Councillor King on that, and he brought forward some changes to the original motion, and we laid it before members of council, and I was pleased that it was supported by so many members of council, recognizing that if we're in a housing crisis, as we voted on, we got to start finding new sources of revenue to put into housing, and that's one of the things that we did today, which I'm proud of. Thank you.
Thanks, Mayor. I'm wondering on the CIP topic, do you see other parts of Ottawa that are ripe for a CIP? Are you happy with the number that are in place right now?
Well, I don't want to close the door for other parts of the city, but as you know, we have a few now, and in order for it to be an effective program, it can't be everywhere. So it's the law of diminishing returns. You know, the more sites you have, the less impactful it is. And I think that we've got some, you know, work to do on the one on Carling, and I think there's some new applicants I'm led to believe that are coming forward for Saint Joseph, as well as Montreal Road. So for the time being, I think until we start to see a few more shovels in the ground of those areas of the city that have a CIP, we should hold off on bringing new ones in. However, I'm not averse to looking at another one or two, but as I said, every area can't have a CIP, then it defeats the purpose of acting as that magnet to that part of the city, whether it's Vanier, Overbrook Forbes, Orleans, Bell's Corners, or the West End. Thank you.
Thanks, Mayor.
Thank you. We will now be going to Blair Crawford at the Ottawa Sun.
Hi, this question is for Dr. Etches. I know you spoke about this at council earlier today, but I wonder if you could reiterate your support for reopening of schools.
Yes, what I can tell you about the situation in Ottawa is that the level of COVID in our community has come down due to the hard work that people are doing right now to limit their close contacts. And so I have to always thank people for doing this. That helps all of us get to a better place, be able to get schools open, businesses back as soon as we can. And that community level dropping is essential because that's the main driver of then COVID in schools. We see from our previous experience that most children or youth who are school age are testing positive because of a close contact in their home or social contact, not because of transmission in schools. The other thing we know in Ottawa is that we have the capacity, we've never lost the capacity to follow up with all contacts and do investigations of any potential spread of COVID in schools. And so our team is ready to work with the school boards, the principals, the students around that follow-up as needed. We also know the level of protection is really important, first of all, to screen, to keep people who have symptoms from coming into the schools, the mask wearing, the cohorting to limit transmission to a cohort. And we have now additional protection from the majority of working age adults between 20 and 65 are now immunized, and that's education workers who had priority access. It's parents of students. So this is an additional benefit that we have now to limit transmission. And we have to put the COVID numbers up against the harms that children, youth, parents of school-age children are reporting, right now, significant mental health challenges with children not having the socialization and the learning that they benefit from in person. And so that's leading us to conclude and recommend for Ottawa at this time that we would see proceeding as the way that's most likely to support the health of our community and children's well-being.
And as a follow-up, we've always seen a big spike after holiday weekends. I'm just wondering if what you saw from this past Victoria Day weekend gives you any concern that we might be in for another mini spike after this.
We are still at risk of a resurgence. I want people to understand that. We had in February, as we proceeded into reopening, then a rate of 27 people testing positive per 100,000 as a weekly average, and it quickly the virus quickly went into an exponential growth situation. So we need to proceed cautiously, and this is the plan that the province has put forward now. It's to go more slowly, and so it's first allowing outdoor recreational amenities to open, and that is that is a situation where there is lower risk of transmission of COVID, especially if you're keeping 2 meters from people outside of your household. And then we have a couple of weeks to assess how that's gone before we get to stage 1 of the reopening plan, where again, the emphasis is on outdoor activity. And so, this is the plan is to take a look with, 2 to 3 weeks between steps to assess that we can continue to keep the COVID level manageable as we, allow for more activities that bring us into close contact with each other.
Thank you very much. Nous allons maintenant passer à...
We will give the floor now to Emmanuel Poisson from Radio-Canada. Go ahead, please. Emmanuel, you have the floor.
Concludes our media avail for today. Ceci conclut notre point de presse. Thank you everyone for your time. Merci pour votre temps. Bonne journée. Oh, Emmanuel, vous êtes là?
Oui, en fait.
Minister Ford, thank you so much for your question. I did the talk to Dr. Etches. I heard many parents, many students. They would love to be able to go back to school for maybe 3 to 4 weeks in June. This will be good for their mental and physical health. Many groups such as CHIO and other members from the medical community think that this would be a good idea for the children. And Dr. Williams, who's the Chief Medical Officer for the province of Ontario, does believe the same thing. It would be nice to have 3 to 4 weeks of in-class schooling. This will be good for the parents, it will be good for the students. This will allow children to say goodbyes because, in 6th grade, you may be moving to another school. So this will be a chance for everyone to say hello in the last week of June. This would be nice for them. Follow-up question? This is for Dr. Etches. So you're supporting the reopening of the school. Do you support that? So it's concerning the reopening, school reopening. Do you support that idea? Yes, I'm sorry. I did say that in French, in English. I can repeat in French. It is very important for the health of our community to help the families, help children and youth, give them the possibility to be in person in the classrooms. We have measures to limit the COVID transmission within the schools. At Ottawa Public Health, we do have a team that is ready to go. We have all the capacity needed to do the follow-up. So if someone has a positive test, we can act. We also have the experience. Actually, what is important is the level of COVID positivity within the community. That is our best indicator. So normally this will tell us what will happen within the schools. Normally they get it through social contacts at home. So we know that the transmission of COVID-19 within the communities is lowering. So it will be important to open the schools here in Ottawa. Thank you so much.
Merci beaucoup à tous. Thank you.
Thank you so much.
Have a great day. Bonne journée.